Hello students, we will briefly discuss another perianal condition which is very common, one of the very common causes of bleeding perianum. Very important perianal condition. Any condition in the perianal region, people say as a this condition. What this condition is, look at that here, you can see here, you can see here, you can see here. Look at the position 3, 7, 11 o'clock position in a clock actually, right side like this. See that it is hemorrhoids or piles. Usually common site is 3, 7, 11 o'clock position. So because right branch hemorrhoidal artery divides into anterior and posterior, left is only one branch. Let's say left side only one, right side 7 and 11. In between secondary prime piles can occur. So what are the parts? Internal, this is internal, this is external. So combination of the internal external piles. So what are the degrees? First degree is here only, second degree comes little bit downward, and third degree comes out and patient pushes inside. Fourth degree is outside, doesn't go inside. So what are the presentations? Bleeding, pain, itching, mass perianum. Bleeding is very common, mass, itching. PR examination and proctoscopy is a must. It's very important. You should do PR. PR piles is so soft you can't feel for it, but thrombosal piles can be felt. Where proctoscopy, you should do it in lateral position with the right knee should be flexed, left knee should be straight, and do a proctoscopy properly. And so visualize the piles and which degree, which type, how many are there, 3, 7, 11 o'clock, everything can assess with that. So proctoscopy is very essential. PR to feel it, but you won't be able to feel unless it is thrombosed, remember. What are the complications? Hemorrhage, thrombosis, suppuration, strangulation, anemia. So this is the prolapsed piles, see that outside. This is the piles parts actually, internal piles, external part, internal piles, external component, internal, external. And the pedicle, it's a pedicle, it's a pile mass. Prolapsed piles, with the ulceration here, ulceration is there, see that? Thrombosed piles, it's thrombosed here. See that? Strangulated piles, so strangulation, because it's the color that it's almost gangrenous. Strangulated piles. So the different complications. What are the treatment? Conservative, sits about the local application, non steroidal type, and anti-inflammatory. If it is infected, give antibiotic for a few days. And sclerotherapy is very useful. Laser, infrared coagulation, Doppler guided hemorrhoidal artery ligation, DHAL, Barron's banding for second degree, cryosurgery, stapled hemorrhoidopexy, Milligan-Morgan hemorrhoidectomy, Parks, good old procedures. Submucous, these are the different procedures, remember. Commonly asked is enumerate surgical procedures for hemorrhoids. Just remember this: sclerotherapy, laser, infrared coagulation, DHAL, Barron's banding, cryosurgery, stapled hemorrhoidopexy, Milligan-Morgan, Parks hemorrhoidectomy. Laser is very useful. Sclerotherapy is also done. All these, so many procedures are there, remember. Very commonly conditioned, very commonly asked questions. Theory they will ask, Viva they will ask, MCQs they will ask, remember. Even though case will not be able to be kept in the exam. But the theory, it is a very common condition, surgical, day-to-day surgery. In OP, you will always see this one. So piles, remember, very common condition for bleeding perianum, remember. But rule out malignancy, always do rectal examination. Proximal growth in the proximal rectum and sigmoid may cause congestion and cause a recent formation of piles. So always do rectal examination. Rule out malignancy in all these patients, especially elderly. In suspected cases, do colonoscopy or sigmoidoscopy. Always remember doing sigmoidoscopy, colonoscopy in all piles patients, especially person who is plus 50. So read my clinical methods in surgery for all examination. Read my surgical manual, current edition, 7th edition, for all your test to test aspect, MCQs, case scenario, detailed explanations, illustrations, photos. Read my operative surgery for procedures of whatever mentioned. Read my tissue approximation or suturing technique, my Diginor lecture to JP publishers. Everything is there in detail, all subjects for UG CME, for PG South, various helpful, basic urology, neurosurgery, cardiothoracic specialties, and with the instrument, X-ray, specimens, and clinical examination. So students, I hope you understood basics about the files very well. Thank you very much.